Hello, everybody, and welcome to this session today. I'm so excited to be here and have the opportunity to speak to you guys. Excited about this conference. Hopefully, you're all getting some great content. So today, this session is really just going to cover how we can use Microsoft Teams to empower your frontline workers in the healthcare industry. I am really excited to talk to you guys today. So my name is Shelly Avery. I am a Microsoft Teams technical specialist for the Health and Life Sciences division at Microsoft. And I have spent the last 3 years focusing specifically on large payers and providers in the United States, just really talking with them about what are their business and clinical challenges, what kind of workflow challenges do they have, and how can we use Microsoft Teams to help in that area? And so I'm really excited to share some of that with you today. Nice to meet you all. So the agenda for today's session is really just to talk a little bit about what is the healthcare communication architecture in many of your environments. So hopefully that is something that you can, that resonates with you. And then let's talk about how Microsoft Teams can help in those areas. Talk about a handful of use cases that I and my peers have discovered with folks like yourself over the last few years. We'll do a demo of and walk through one specific use case, and then just kind of wrap up with some next steps. Hopefully that sounds good to everybody. So starting off with the healthcare communication architecture, hopefully this is familiar to most of you. And what we like to talk about is we know that healthcare has a very broad and deep communication architecture. It has many different pillars that come with it. On the left, you see medical records like population health, your EHR, your patient records, your orders, your lab results, your PACS systems. And then on the going towards the right, we have communication and collaboration, which we really feel that Microsoft's sweet spot sits in there. And then also portals and knowledge base. There is so much training and content sharing across the organization in healthcare that it is really important to talk about that as well. And then finally, you have your paging, overhead paging, physical pagers. We know a lot of people still have this technology in healthcare. But what we've learned through interviews and shadowing and just talking to healthcare professionals is that a lot of the different systems that encompass these medical records, communication and collaboration are disparate. And so what we found is the technology burden it takes for a healthcare worker to learn each and every one of these can become very burdensome. And so what we have found is if you can really just kind of centralize and bring together these communication, collaboration, and portals to a single unified place, it can really decrease the amount of technology burden, the technology switching, and even the mental capacity it takes for a healthcare worker to do their day-to-day job. So for example, you see here on the screen, we've added some logos into this slide. Same information, but this is a real world customer who had, Epic and Haiku. They had Tiger Connect. They were using Box and Dropbox. They had Spoke and Tiger Connect for messaging. You see Facebook on there. We have a lot of healthcare providers that just gravitate towards Facebook Messenger or Facebook groups because it becomes easy and is natural to them. And then you see things like OneDrive and Box that are cloud technologies for storage, but they're disparate, and you don't know necessarily where your file is, if it's in one location or another, depending on who you're communicating with. And so that becomes burdensome. And so again, just streamlining all of that technology by integrating Microsoft Teams in that area can really help decrease the time spent in trying to find your data or learning who you can communicate with. And so finally, I wanted to call out, notice that we did not highlight the medical record column. We are not here to ask you to rip and replace or even remove your systems of record. Your medical record is your system of record, and we do not want to compete in that space, but what we do want to is integrate with. And so the rest of the session today, that's really what I want to focus on, is how can you streamline your communication and collaboration, even your portals and knowledge base, into a single platform while integrating with your systems of record to increase efficiency and workflow in your organization. So the very next thing I want to talk about is Microsoft Teams, as well as all of the Microsoft 365, Azure, and Dynamics platforms all meet the certifications and compliance regulations that are required in the healthcare industry. So I've just put a handful on the slide here, but in the payer and provider community, which is what I'm going to focus most on today, we do meet all the HIPAA and high trust certifications. We also have GDPR and FedRAMP. So we do meet the requirements needed to put patient information into Microsoft Teams. So when we talk about integrating with your medical record or labs and bringing that information into Teams to enhance the collaboration and communication around that data, please rest assured that it is certified and it is compliant, and we can definitely help you make sure that you are staying within standards for this area. So moving on, let's talk about some use cases that we're seeing in our healthcare industry that is helping increase this collaboration and communication. So just to name a few, we'll review some of these in more depth, but definitely secure messaging is huge. Taking those things like Tiger Connect or Spoke or even Facebook groups and solidifying them into one single platform allows for increased efficiencies amongst the organization. And we're not saying that Tiger Connect and Spoke and those don't have their place. They do. But the challenge that you have with those is when that clinical workflow needs to include folks like facilities or even security or IT, is now they have to think about, who do I need to communicate with? Is this someone who has access to this pointed secure messaging solution, or do they not have access? And so I have to decide, which application do I use to communicate with these people? With Microsoft Teams, everybody in the organization can have the same platform and can communicate across use cases. Care team collaboration is huge. Bringing any of those huddles or shift handovers into the collaboration space of Microsoft Teams is really increasing efficiencies and outcomes for our health providers. Virtual visits has been huge in the last few months. We've seen a skyrocket in the health industry, whether it's on Teams or on other platforms. It is just really booming right now. It's because of what's going on in the world, so many people are now taking to technology to have those doctor-patient interactions. And then virtual rounding is more around inpatient. How do we keep the doctor and patient on the same page? How do we get the nurse to communicate with the patient, but continue having social distancing, or allow that provider to stay home or in his work office and still be able to communicate with patients that are at disparate facilities or across campuses? And so increasing efficiencies for folks to be able to talk to their patients, making that virtual allows them to communicate with people across distance and time. Multidisciplinary rounds or MDRs or IDTs or huddles or handoffs. We have situational and readiness huddles. Everybody calls their huddles or their rounds something different. So insert your title of what your organization calls them. And these kind of multidisciplinary or cross-team collaboration spaces, whether it's around the patient or whether it's around situations or readiness, we have seen tremendous value in this area. So let's dig into each of these a little bit more. So secure messaging with Microsoft Teams. Microsoft Teams is secure. We talked about this earlier. It is HIPAA compliant. It is HITRUST certified. It meets GDPR regulations. But maybe some things that you don't know about Microsoft Teams that are really important in the healthcare space around secure and priority messaging is some features that have been built into the product that are really nice for our clinical workers. So priority notifications, being able to escalate that message to not only important but urgent, breaking through the silent barrier of a smartphone, even though it might be in their pocket and silent. We need them now. Let's make sure that they hear us. Image annotation, allowing users to take pictures using their smartphone, annotate on that picture, and then being able to share that image using the Microsoft Teams platform without storing that image on their local device. That keeps it HIPAA compliant. Federated messaging is being able to communicate with people outside of your organization without having to license them or pay for that. Super important in a healthcare space to be able to communicate with guest physicians or external folks that you need consults from. Read receipts is another one that helps in the HIPAA compliant area. Being able to time and date stamp every time a message is sent, when it is received, and when it is viewed. Across the bottom, you can see here's some advanced messaging features. So you can message people based on roles or tags in the organization. So you don't maybe not know who the pharmacist is that is on shift right now. So you just want to message the pharmacist. And so whoever is on at that time will get that message. And then integrating that into Shift Manage It, being able to target the pharmacist who's actually scheduled at that time and send them a message. Message delegation is huge for doctors in surgery. Think about being able to set a small little out of office for teams that says, hey, I am going to be in surgery for the next 6 hours or 8 hours. Please contact my physician assistant while I'm away. Really important way to have that direct and communication back to the people that are trying to reach you to let them know you're going to be kind of out of office for or unavailable for the next few hours, but then gives you someone else that they can reach out to based on who you want to be your delegate. And then finally, presence-based messaging, knowing when your calendar is free or busy, when you're presenting or when you're not on Do Not Disturb, so people can see that and know whether or not you should be able to respond quickly. So moving on a little bit to care coordination in Microsoft Teams. This has really been a huge area of value that we've seen to our providers. I'm not going to go through each and every one of these individually, but really the use cases here are endless. Just think about any time folks meet physically and huddle or have a meeting around physical information that they are sharing, whether it is handing off from the AM shift to the PM shift, doing those multidisciplinary roundings on patients, even bringing lists or data in from the medical record to talk about the status of a patient or helping them progress in their care plan. These are really great areas for process improvement and efficiencies. And we'll dig deeper into one of these as we go into a demo here in a little bit. And then finally, I'll hit on virtual consults. So a lot of people, when we talk to them, when they think about virtual consults, the first thing they think about is telehealth. And yes, that is a form of virtual consult. From the provider to the patient is not in the facility. That would be one use case. But there are many other use cases for virtual consults, like clinician to clinician, kind of consults, or some people call them curbside consults, reaching from one doctor at one facility to another doctor at another facility or even another organization. Clinicians have to keep up on learning and training for their continuing education. Another great way for a doctor or a physician or even a professor to be able to reach out to a large group of individuals for learning and training. So hopefully you're seeing here that the ability to host or have, like we are doing virtual meetings today, just put those clinicians and doctors in their normal day-to-day interactions. We can have those and host those on Microsoft Teams from a meeting or large event perspective. So I'd love to dig into a demo with you guys and showcase how one of our providers has really transformed the way they do their multidisciplinary rounding. So I'm going to just switch my screen really quick. All right. So I am showing Microsoft Teams over here in the browser. Hopefully you all are aware that you can get to Microsoft Teams on a mobile device, browser, or desktop. And so that makes it really easy for our clinical workers who might have shared workstations. Maybe they don't have a dedicated PC. They can open up Microsoft Teams on any of their devices, whether it is the desktop or the browser, or even access it on their smartphone. So inside of Microsoft Teams, I have this example of a patient navigator team. You can see we have multiple channels here. I want to talk about a use case that we learned from one of our providers around multidisciplinary rounding. When we met this customer, we learned that they had a goal in their organization to reduce the average length of stay for their patients. Now, they weren't looking to push their patients out on the street, but what their goal is to get the patient discharged as quickly as possible once they were medically ready. And so they had MDR huddles, or discharge planning huddles, every morning on every unit in the entire organization. And they ran these huddles with these physical whiteboards that you can see an example here. I hope you can tell by the small writing and the scribbling and color coding that they were struggling with capturing the information that they needed. This also was physical. There was no digital version of it. So unless you were standing right there, there was no way to see this information. They even talked about having a challenge that sometimes people's shoulders or elbows would scrape up against the whiteboard and data would get erased. It was very challenging for them. Even when they did their huddles, the lady who had to be the scribe had to stand on a stool just to reach the top row. So lots of physical limitations and barriers to this data collection and sharing with others. As you can see at the top, we have an example of an Excel spreadsheet. And then also down at the bottom, you can see we have a little circle around a TV. What we were able to do was take the exact same information that was on the physical whiteboard, and we quickly turned it into an Excel spreadsheet put it in a team, and taught the nurses and doctors how to co-author. And so that was our first step on the journey to digitizing their MDRs, or multidisciplinary rounds. But we knew that there were still challenges. We needed more automation. We needed a better way for the clinicians to be able to see the data while they were on the go and moving around the hospital. So we continued to work with them, and we created a huddle board using Microsoft Teams list app. So you can see here, I have a tab here built off of Microsoft lists inside of Teams, where we replicated the rows and columns associated to what used to be a whiteboard, then became an Excel spreadsheet. The way they were able to do this was quickly be able to pull all of the information in around the different patients that were on their unit. They even got so excited about the different color coding and being able to set formulas in here. So you can see we have a discharge date. If because they were planning for discharge, this was all around getting the patient discharged once they were medically ready. And so you can see they have a planned discharge date. What this is doing is actually calculating based on today's date and highlighting it in bold and making a red indication over here. So we have conditional formatting built into this to indicate triggers or information that they might need to know or see that is important to them. They learned very quickly that one of the barriers to discharge was being able to set up the proper transportation to the facility that the patient was being discharged to. So knowing where they were being discharged was incredibly important in their discharge planning. If they were going home, did they have a family member, spouse, or a loved one that could drive them home? If they were going to rehab, was there an ambulance or someone that was ready and prepared to take them? Maybe they were homeless and they needed to find better transportation for this individual because they didn't have anyone that could pick them up. So knowing that information and capturing it on the huddle board as they rounded each morning, they could come in here and quickly edit this information by using drop downs and let each other know what the status is of this patient. So being able to quickly come in and then toggle between the next patient, round on this patient, get advice and information from the provider, being able to add quick notes for the group to be able to see was incredibly valuable for them so that they weren't waiting on others and to get the information they need. You can also share a row in the list by copying this and extending access to the people that need it. So maybe you are having to have a curbside consult with someone that isn't a part of your team around this patient. You would be able to apply and share this information by copying the link and sharing that out with a doctor, and then setting up a quick call or meeting with them to review the patient's status to see what is going on or what might need to happen next in the care plan. Because all of this is in the construct of the team, when you go back to the channel or to the conversation, you can see that you can have threaded conversations associated to the patient and quickly click into that patient to see the information associated to them. So you can look at all the relevant information that might be happening in their care plan. It shows up over here and people can quickly reply and let you know what is going on. So we can see that David Aaron is improving. We're working towards his discharge date, and we can collect any attachments around the documentation or status as we have their MDRs. Also, what we were able to do for them is create some dashboards, analytics, and reporting. It was really important for this customer to be able to learn from their MDR huddles. When they found a barrier, like the one about knowing where the patient was going afterwards, where were they being discharged to? They created a barrier to discharge. By tracking what barriers were causing these patients to not be discharged, they were then able to create best practices and plans around how do we remove those barriers. And by removing those barriers, they could update their best practices and standard of work to increase the efficiency of that discharge planning for those patients. They're able to do that with analytics and dashboards like this one by calculating the different demographics of the patient or of the DRG or diagnoses. They could drill down into each unit or each DRG to learn which DRG is causing them to have delays in discharge, or potentially where a unit is doing better and a unit isn't doing as well. So you can compare what is going on. Maybe someone is intervening earlier with their discharge planning versus another unit. These analytics are also able to be aggregated up across the entire system. So even at the nursing director or informatics level, or even the C levels of each facility can drill down into knowing how many patients do we have being discharged today versus tomorrow? Do we have any patients that are medically ready, but they have barriers to discharge? How can we remove those barriers, any blockers that maybe from an administration perspective or a transportation perspective, we can escalate to get this patient home happy and well? By pulling in all that information into a Power BI dashboard, we can even create triggers or alerts that flow back into the team to alert people as certain criteria are met. That way they aren't having to dig into the data. It's really being surfaced to them right in the team. So just reviewing some of the results for this customer. We were able to run a pilot with them. 3 units used the Microsoft Teams and 3 units were not using Microsoft Teams. And you can see on the left, when the pilot began, this unit was at 5.47 average length of stay for their patient. And over time, we're able to reduce that down to 4.3 days. And subsequently over here, when the pilot began, you can see that it increased to 6.3 days. So the average length of stay drastically decreased over the pilot units compared to the control. The financial impact for the acute care units on their average length of stay went down as well. And drilling down into the financial impact, it was calculated that on average, the patient cost per day was $300. And because of their excess days of 697 days times 300, they were able to save over $200,000 just in a short period of time from March 3rd to June 1st. But if they were able to extrapolate and expand this savings, these 3 units could save over $800,000 a year. So with the positive results they were able to achieve, the system has now started rolling this out and implementing their multidisciplinary rounding using Microsoft Teams lists embedded into their teams to implement these huddles to work on having these same financial results around the rest of the facility. So just flipping back over as a summary, I hope you now have seen that Microsoft Teams is a secure and compliant platform, and it can create constant process improvement in the organization. It can create ease of digital transformation because it is always on and accessible from anywhere. The information is shareable from the front line to mid-management all the way up to C-levels. And so when you're able to have a secure and compliant platform that's available to everyone in the organization, process improvement can become an easy part of day-to-day collaboration. The biggest thing that I hope you can have from this takeaway, it's not just process improvement, but the reduction of time spent preparing for each huddle each day for these nurses was drastically reduced. They were each going out and doing their individual preparedness for the huddle to capture the information that they needed to be ready. But by putting it in an aggregated list, they were able to quickly look at the list and get up to speed on the information they needed to be ready for the day, instead of having to each going out to individually do their own investigation. Also, the patients were returning home sooner to see their family. I mean, just think if you had a loved one or you were in for surgery and you were medically ready to go home and you couldn't because of paperwork or insurance or transportation wasn't prepared properly for you. That is the worst feeling. And so now, by intervening early and preparing for these things, patients were able to go home earlier to see their family. And the nurses and doctors were incredibly pleased with this because they were more joyful and able to get their patients home, which is really what they are there to do each and every day, to help get those patients well and on their way. So I really hope that this has opened your eyes to Microsoft Teams is not just a chat and meeting application. It really can be a productivity and a cost-saving application that you have in your environment. So I ask you, what problem can Teams solve for your organization? What kind of business challenges or clinical workflows can you think about to bring to the table to create process improvement? And don't worry about going out and buying a pointed solution that costs money and then have to implement and you need to support. Usually Microsoft Teams can use slight customizations to allow you to accomplish very similar goals and have everybody have much better work-life balance and reduce the technology burden from switching from different applications. So I would love to open it up to see if anybody has any questions, and we definitely value your feedback and want to engage with you if there are any needs or questions that you may have.
Thanks, Shelly, for your, this session. It's very informative. And yeah, a couple of questions, so like, are there any, predefined template in a team? For example, like management, like for ambulance, transportation, or wards, that can be utilized to manage this work as properly.
Yeah, great question. So we definitely have different types of templates. We have Microsoft Teams templates that you can use to start your team. We also have Microsoft List app templates. And there are certain app templates for List around patient huddling that is built into the List app. There's also one on incident management, and there even are many other ones that are in there for different use cases. So I definitely recommend just adding that List app as a tab in your team and checking out the templates that are there already. And then once you have the template started, you can customize it based on, if it doesn't meet your needs fully.
Thank you. And how about, let's say scheduling of a staff, like a nurses or a doctor, or maybe a, cleaning staff. So how that is going to help in Microsoft Team?
Sure. So I think I understand the question around kind of shift management or scheduling of frontline workers. If that's not it, please ask again so I can clarify. But Microsoft Teams has a native app called Shifts that is built in. I talked about it slightly with the secure messaging application. So Shifts is a scheduling component. So a lot of our organizations are using Shifts for on-call schedules, just so you can have a quick view of who's on call and be able to send them a message or even send them an urgent message if they need to report in based on their on-call schedule. We also integrate Shifts with many workforce management applications like SAP or Amion or other high-powered rules-based scheduling engines, and then ingesting those schedules into Microsoft Teams Shifts so you can, again, keep going back to that original slide, is you can streamline the technology needed for your frontline workers so you can continue adding value into a single application. They don't have to switch from one app to another to do all of their day-to-day needs. Hopefully that answered your question. There's tons and tons of content around scheduling and shifts with Microsoft Teams. So I hope you investigate that more or reach out to your trusted advisor to get more information on that one.
Thank you so much, Sally, and I really appreciate. Thanks, audience. Thank you. Good day.
Awesome. Thank you, everybody.